A patient presents with a serum calcium level of 11.2 milligrams per day, 9 to 10.5. Which of the following symptoms would the nurse most likely expect to find? A. Tachycardia. B. Hypertension. C. Shortened QT interval on the EKG. D. Diarrhea. Correct answer. C. Shortened QT interval on the EKG. Rationale. Hypercalcemia often leads to a shortened QT interval on an EKG, which reflects changes in cardiac electrical activity due to increased calcium levels. Tachycardia and hypertension are not typically associated with hypercalcemia. Diarrhea is more commonly associated with hypocalcemia. The nurse is assessing a patient for Chvostek sign. This assessment is indicative of which electrolyte imbalance? A. Hypercalcemia. B. Hypocalcemia. C. Hyperkalemia. D. Hyponatremia. Correct answer. B. Hypocalcemia, 9.0 to 10.5. Rationale. Chvostek sign, characterized by facial muscle twitching when the facial nerve is tapped, is a clinical sign of neuromuscular excitability seen in hypocalcemia, indicating low calcium levels in the blood. This sign helps in the early detection and management of calcium imbalances. A patient with hypercalcemia is prescribed furosemide, Lasix. The nurse knows that the purpose of this medication in this patient is to A. Reduce blood pressure. B. Promote renal excretion of calcium. C. Decrease risk of seizures. D. Treat pulmonary edema. Correct answer. B. Promote renal excretion of calcium. Rationale. Furosemide, Lasix, is a loop diuretic that increases urine production, promoting the renal excretion of calcium in patients with hypercalcemia. This effect helps in lowering elevated calcium levels in the blood, addressing one of the critical management steps for hypercalcemia. A patient with a recent thyroidectomy has a calcium level of 8.8 mg/dl, low. For which symptom is it most important for the nurse to monitor? A. Trousseau sign. B. Hypertension. C. Bradycardia. D. Polyuria. Correct answer. A. Trousseau sign. Rationale. Post-thyroidectomy patients are at risk for hypocalcemia due to potential damage or removal of the parathyroid glands. Trousseau sign, a carpal spasm induced by inflating a blood pressure cuff, is a specific indicator of latent tetany in hypocalcemia, which necessitates prompt recognition and treatment. A patient with cancer has developed hypercalcemia. Which of the following interventions should the nurse anticipate? A. Administration of calcium gluconate. B. Encouragement of a high-phosphate diet. C. Restriction of fluid intake. D. Encouragement of a high-calcium diet. Correct answer. B. Encouragement of a high-phosphate diet. Rationale. Recall that phosphate and calcium have an inverse relationship. When one is high, the other is low. A high-phosphate diet is recommended for patients with hypercalcemia, as phosphate can bind to calcium, reducing its levels in the blood. This dietary approach is part of the management strategy for hypercalcemia, aiming to balance electrolytes and mitigate the condition's symptoms. A nurse is caring for a patient with hypermagnesemia. Which of the following findings would be expected during assessment? A. Hyperactive deep tendon reflexes. B. Trousseau sign. C. Prolonged PR interval on the EKG. D. Elevated blood pressure. Correct answer. C. Prolonged PR interval on the EKG. Rationale. More magnesium implies more mellow. Hyperactive deep tendon reflexes, Trousseau sign, and elevated blood pressure are typically associated with hypocalcemia, not hypermagnesemia. Hypermagnesemia can cause a prolonged PR interval on the EKG due to the depressant effect on the myocardial function. Which medication is most appropriate for the nurse to administer to a patient with hypermagnesemia and decreased muscle excitability? A. Magnesium sulfate. B. IV calcium gluconate. C. Oral magnesium oxide. D. Furosemide, Lasix. Correct answer. B. IV calcium gluconate. Rationale: magnesium sulfate and oral magnesium oxide are not suitable for treating hypermagnesemia because they would actually increase magnesium levels, which is the opposite of what you want in this situation. Furosemide, Lasix, is a diuretic that could potentially lower magnesium levels, but it's not the main treatment for the decreased muscle excitability that comes with hypermagnesemia. IV calcium gluconate is the preferred medication in this case because it can counteract the effects of too much magnesium on muscles and nerves, helping to restore normal function. A patient with chronic alcoholism presents with tremors and hyperactive reflexes. The laboratory results show a magnesium level of 1.1 milligrams per deciliter. The nurse should prepare to administer which of the following? A. IV calcium gluconate. B. Oral potassium chloride. C. IV magnesium sulfate. D. Subcutaneous insulin. Correct answer: C. IV magnesium sulfate. Rationale: a magnesium level of 1.1 milligrams per deciliter is below the normal range of approximately 1.3 to 2.1 milligrams per deciliter, indicating hypomagnesemia. Symptoms such as tremors and hyperactive reflexes can occur with this condition. IV magnesium sulfate would be used to correct the deficiency. The other options are not indicated for hypomagnesemia. For a patient diagnosed with hypomagnesemia, which dietary recommendation is most suitable? A. Increase intake of leafy greens, nuts, and whole grains. B. Consume a diet high in dairy products and low in phosphate. C. Restrict intake of chocolate, avocados, and bananas. D. Encourage the consumption of diuretic foods like cranberries and coffee. Correct answer: A. Increase intake of leafy greens, nuts, and whole grains. Rationale: foods such as leafy greens, nuts, and whole grains are rich in magnesium, which would help in treating hypomagnesemia. The other options do not specifically address increasing dietary magnesium or may promote magnesium loss. A patient with end-stage renal disease on hemodialysis develops hypermagnesemia. What is the most effective nursing intervention for this condition? A. Increase dietary magnesium intake. B. Administer a loop diuretic. C. Perform hemodialysis with a low magnesium dialysate. D. Prescribe a phosphate binder. Correct answer: C. Perform hemodialysis with a low magnesium dialysate. Rationale: in patients with renal failure, the kidneys cannot excrete magnesium effectively. Hemodialysis with a low magnesium dialysate can remove excess magnesium directly. Increasing dietary magnesium would be inappropriate and could worsen the condition. Loop diuretics may not be effective due to renal disease and do not directly address magnesium levels. Phosphate binders do not affect magnesium levels. A nurse is reviewing the laboratory results of a patient and notes that the serum phosphate level is 5.0 milligrams per deciliter. Considering the normal serum phosphate range is 2.7 to 4.5 milligrams per deciliter, which condition does this patient most likely have? A. Hypophosphatemia. B. Hyperphosphatemia. C. Hypocalcemia. D. Hypercalcemia. Correct answer: B. Hyperphosphatemia. Rationale: a serum phosphate level of 5.0 milligrams per deciliter exceeds the normal range of 2.7 to 4.5 milligrams per deciliter, indicating hyperphosphatemia. Hyperphosphatemia can occur in conditions such as renal failure, where the kidneys are unable to excrete phosphate effectively, or in cases of excessive intake of phosphate, which could be dietary or from phosphate-containing medications. It is important to manage hyperphosphatemia because it can lead to calcification in tissues if not treated, especially when associated with chronic kidney disease. A patient with chronic kidney disease (CKD) has developed hyperphosphatemia. Which other electrolyte imbalance should the nurse monitor for given the reciprocal relationship between serum phosphate and calcium levels? A. Hyperkalemia. B. Hypernatremia. C. Hypocalcemia. D. Hypermagnesemia. Correct answer: C. Hypocalcemia. Rationale: hyperphosphatemia in patients with chronic kidney disease (CKD) can lead to hypocalcemia due to the reciprocal relationship between serum phosphate and calcium levels. When phosphate levels are high, calcium levels can decrease because phosphate binds with calcium, reducing the amount of free calcium in the bloodstream. This imbalance can contribute to various clinical issues, including increased risk of cardiovascular disease and bone disorders like osteoporosis or renal osteodystrophy in CKD patients. The nurse is caring for a patient who is recovering from diabetic ketoacidosis, DKA, and notes that the patient has a serum phosphate level of 2.6 milligrams per deciliter. The nurse anticipates that the healthcare provider will order which of the following treatments? A. Oral phosphate supplements. B. Phosphate binding agents. C. Calcium gluconate IV. D. Restriction of dietary phosphate. Correct answer. A. Oral phosphate supplements. Rationale. In patients recovering from diabetic ketoacidosis, DKA, a serum phosphate level of 2.6 milligrams per deciliter, which is slightly below the normal range, may be observed. This condition, known as hypophosphatemia, can occur as insulin therapy is initiated and glucose begins to enter cells, carrying phosphate along with it, thus lowering serum phosphate levels. Oral phosphate supplements may be ordered to correct this imbalance and prevent complications associated with hypophosphatemia, such as muscle weakness and cardiac dysfunction. A patient is diagnosed with hyperphosphatemia. Which dietary modification should the nurse educate the patient about to help manage serum phosphate levels? A. Increase consumption of dairy products. B. Increase intake of whole grains. C. Avoid foods high in phosphate like meats and beans. D. Consume more leafy green vegetables. Correct answer. C. Avoid foods high in phosphate like meats and beans. Rationale. In managing hyperphosphatemia, it is critical to modify the diet to reduce phosphate intake. Foods high in phosphate include meats, beans, dairy products, and certain grains. Educating the patient to avoid or limit these foods can help lower serum phosphate levels and mitigate the risk of complications associated with hyperphosphatemia, such as vascular calcification and secondary hyperparathyroidism. Diet plays a significant role in controlling phosphate levels, especially in patients with renal impairment, where phosphate excretion is compromised. What condition is most likely responsible for a patient's decreased urine output and elevated BUN and creatinine levels after consuming a large volume of antacids? A. Prerenal AKI due to decreased perfusion. B. Intrinsic AKI from nephrotoxic injury. C. Postrenal AKI due to urinary tract obstruction. D. Chronic kidney disease from prolonged hypertension. Correct answer. B. Intrinsic AKI from nephrotoxic injury. Rationale. The use of antacids that may contain nephrotoxic substances like magnesium, along with the clinical findings of reduced urine output and increased BUN and creatinine levels, point towards an intrinsic AKI caused by a direct kidney injury, likely from the nephrotoxic effects of the ingested substances. Which lab finding is associated with the oliguric phase of acute kidney injury, AKI? A. Urine output of 450 milliliters per day. B. Serum potassium of 3.5 milliequivalent/L. C. Urine specific gravity of 1.010. D. Serum creatinine of 1.5 milligrams per deciliter. Correct answer. A. Urine output of 450 milliliters per day. Rationale. The oliguric phase of AKI is characterized by significantly reduced urine output, typically less than 400 milliliters per day, which indicates inadequate kidney filtration. A urine output of 450 milliliters per day, slightly above the typical cutoff, is still suggestive of reduced kidney function. What immediate action should a nurse take when a patient becomes restless and reports a headache during hemodialysis? A. Administer pain medication as ordered. B. Stop the dialysis treatment and assess for disequilibrium syndrome. C. Encourage the patient to rest and provide a quiet environment. D. Check the patient's blood sugar level. Correct answer. B. Stop the dialysis treatment and assess for disequilibrium syndrome. Rationale: restlessness and headache during hemodialysis could signal disequilibrium syndrome, a potential complication of dialysis. The nurse should promptly cease treatment and perform an assessment to confirm the condition and prevent further complications. Which dietary modification should be implemented for a patient with acute kidney injury, AKI? A. Increase protein intake to promote healing. B. Restrict potassium intake to avoid hyperkalemia. C. Encourage fluids to flush the kidneys. D. High phosphorus diet to compensate for renal losses. Correct answer: B. Restrict potassium intake to avoid hyperkalemia. Rationale: in AKI, especially during the oliguric phase, it's critical to restrict dietary potassium to prevent hyperkalemia, as the kidneys are not able to eliminate potassium effectively, which could lead to serious cardiac complications. What is the initial intervention for a patient with end-stage renal disease, ESRD, presenting with a high potassium level and ECG changes indicative of hyperkalemia? A. Oral administration of sodium polystyrene sulfonate, Kexolate. B. Intravenous infusion of 10% calcium gluconate. C. Preparation for immediate hemodialysis. D. Administration of IV regular insulin with dextrose. Correct answer: B. Intravenous infusion of 10% calcium gluconate. Rationale: IV calcium gluconate is used as an immediate intervention in hyperkalemia to stabilize cardiac membranes and prevent arrhythmias, which are life-threatening complications of elevated serum potassium levels. Hemodialysis may follow as a subsequent treatment to remove excess potassium from the bloodstream. Which nursing intervention is most appropriate for a patient with AKI in the diuretic phase with a significant increase in urine output? A. Limit fluid intake to prevent fluid overload. B. Monitor for signs of hypovolemia and electrolyte imbalances. C. Continue to restrict the patient's potassium intake as in the oliguric phase. D. Encourage a high-protein diet to promote renal recovery. Correct answer: B. Monitor for signs of hypovolemia and electrolyte imbalances. Rationale: in the diuretic phase of AKI, patients often experience a significant increase in urine output, which can lead to hypovolemia and electrolyte imbalances, including hypokalemia. It is essential to monitor and manage these potential complications to avoid additional renal stress and support recovery. In assessing a patient with AKI, which finding would the nurse recognize as a possible indication of an improvement in renal function? A. An increase in urine-specific gravity. B. A decrease in serum creatinine and BUN levels. C. Persistent oliguria. D. Continuing hyperkalemia. Correct answer: B. A decrease in serum creatinine and BUN levels. Rationale: decreases in serum creatinine and BUN levels are indicative of improved kidney function, as these waste products are being filtered and excreted more effectively. An improvement in these laboratory values is a positive sign that renal recovery may be occurring. What pathophysiological mechanism primarily contributes to metabolic acidosis in a patient with AKI? A. Overproduction of bicarbonate due to kidney damage. B. Accumulation of acidic metabolites due to decreased filtration. C. Loss of acidic gastric fluids due to vomiting. D. Increased reabsorption of bicarbonate in the renal tubules. Correct answer: B. Accumulation of acidic metabolites due to decreased filtration. Rationale: metabolic acidosis in AKI occurs due to the buildup of acidic metabolites, like hydrogen ions, that the kidneys are unable to filter and excrete effectively. This accumulation leads to the acid-base imbalance known as metabolic acidosis. Which intervention should the nurse prioritize for a patient with CKD and a serum phosphate level of 5.2 mg per deciliter? A. Encourage increased intake of dairy products. B. Administer phosphate binders with meals. C. Decrease the patient's fluid intake. D. Provide magnesium-based antacids. Correct answer: B. Administer phosphate binders with meals. Rationale: in CKD, the kidneys are less able to excrete phosphate, leading to increased serum levels. Phosphate binders are used to bind phosphate in the gastrointestinal tract and prevent its absorption, which helps to control hyperphosphatemia. Which symptom is most likely due to decreased erythropoietin production in a patient with late-stage CKD? A. Hyperkalemia. B. Hypertension. C. Anemia. D. Edema. Correct answer, C. Anemia. Rationale: erythropoietin, produced by the kidneys, stimulates the bone marrow to produce red blood cells. In CKD, reduced production of erythropoietin can lead to anemia, with symptoms such as fatigue and pallor. What does uremic frost indicate in a CKD patient? A. Risk for skin infections. B. Excess buildup of urea being secreted through sweat glands. C. Hyperphosphatemia. D. Reaction to phosphate binders. Correct answer, B. Excess buildup of urea being secreted through sweat glands. Rationale: uremic frost occurs when urea and other waste products are excreted through the skin due to severe uremia. It appears as a white crystalline residue and is a sign of advanced kidney failure. In a CKD patient with hypermagnesemia, what should the nurse advise the patient to avoid? A. Magnesium-based antacids and laxatives. B. Potassium-rich fruits like bananas and oranges. C. Phosphorus-containing foods such as dairy and nuts. D. High-protein foods like red meat and poultry. Correct answer: A. Magnesium-based antacids and laxatives. Rationale: CKD patients often experience hypermagnesemia due to the kidney's reduced ability to excrete magnesium. Therefore, patients should avoid magnesium-based products to prevent further increases in magnesium levels. According to the National Institute of Diabetes and Digestive and Kidney Disease Health Statistics, how is CKD classified with a GFR of 18 milliliters per minute? A. Stage 2. B. Stage 3. C. Stage 4. D. Stage 5. Correct answer: C. Stage 4. Rationale: Stage 2, G2. eGFR, 60 to 89 milliliters per minute. Description: mildly decreased kidney function with other signs of kidney damage. Stage 3, G3A. eGFR, 45 to 59 milliliters per minute. Description: mild to moderately decreased kidney function. Stage 4, G4. eGFR, 15 to 29 milliliters per minute. Description: severely decreased kidney function. Stage 5, G5. eGFR, below 15 milliliters per minute. Description: kidney failure, almost complete loss of kidney function. Which statement by a patient with stage 5 CKD indicates a need for further education regarding fluid restrictions? A. I should avoid foods that are high in moisture, like soups and watermelon. B. I will measure and record all liquids I drink to ensure I don't exceed my fluid limit. C. Drinking more fluids will help clear out the toxins from my kidneys. D. I need to be aware of hidden fluids in my diet, such as ice cream and gelatin. Correct answer: C. Drinking more fluids will help clear out the toxins from my kidneys. Rationale: this statement reflects a misunderstanding. In stage 5 CKD, patients must limit fluid intake due to the kidney's reduced ability to excrete fluids, not increase it. For a CKD patient prescribed sevelamer, a non-calcium-based phosphate binder, what is the primary reason for this choice? A. To reduce the risk of hypercalcemia, which can lead to vascular calcification. B. Non-calcium-based phosphate binders are less likely to cause constipation. C. To increase the efficacy of vitamin D supplementation. D. To promote the excretion of potassium through feces. Correct answer: A. To reduce the risk of hypercalcemia, which can lead to vascular calcification. Rationale: the top 3 most commonly used non-calcium-based binders for treating hypercalcemia are sevelamer, G4, lanthanum, aluminum hydroxide. Non-calcium-based phosphate binders are used to prevent the rise in calcium that could lead to vascular calcification, a serious complication in CKD patients. Besides dietary restriction and pharmacological interventions, what other strategy might be considered to manage hyperkalemia in a patient with CKD? A. Increase dietary protein intake. B. Start bicarbonate supplementation. C. Initiate low-intensity aerobic exercise. D. Increase the frequency of dialysis treatments. Correct answer. D. Increase the frequency of dialysis treatments. Rationale: increasing the frequency of dialysis treatments can help manage hyperkalemia in a patient with chronic kidney disease, CKD, by removing excess potassium from the blood. The incorrect ones. Option A, increasing dietary protein intake can worsen hyperkalemia in CKD due to increased waste products, including potassium. Option B, bicarbonate supplementation corrects metabolic acidosis in CKD, but doesn't directly manage hyperkalemia and may cause metabolic alkalosis if not monitored. Option C, exercise, while beneficial for health, isn't a direct strategy for managing hyperkalemia and can increase blood potassium levels if intense. It should be guided by a healthcare professional. What is the most appropriate statement by the nurse regarding the initiation of antiretroviral therapy for a patient newly diagnosed with HIV? A. We will start treatment only when your symptoms become severe. B. Antiretroviral therapy should begin as soon as possible to decrease your viral load. C. Treatment is optional and can be initiated based on personal preference. D. You should wait for your CD4 count to drop below 200 before starting treatment. Correct answer. B. Antiretroviral therapy should begin as soon as possible to decrease your viral load. Rationale: antiretroviral therapy, ART, is a treatment regimen involving a combination of medications that suppress the replication of HIV, human immunodeficiency virus, thereby reducing the viral load in the body and helping to maintain a healthy immune system. Current guidelines recommend starting antiretroviral therapy, ART, as soon as possible after an HIV diagnosis, regardless of CD4 count. Early treatment has been shown to reduce the viral load, preserve the immune system, prevent the progression of HIV to AIDS, and reduce the risk of HIV transmission. During a session on preventing HIV transmission, what advice should the nurse prioritize to a patient engaged in needle-sharing practices? A. Consider the use of pre-exposure prophylaxis, PrEP. B. Use a new, sterile needle for each injection to prevent transmission. C. Limit the number of partners you share needles with. D. Boil your needles and syringes to ensure they are clean. Correct answer. B. Use a new, sterile needle for each injection to prevent transmission. Rationale: the highest priority and most effective way to prevent HIV transmission in people who inject drugs is to use a new, sterile needle for each injection. Pre-exposure prophylaxis, PrEP, is a preventive strategy that involves regular intake of antiretroviral medications such as Truvada, Descovy, or Apretude by individuals at high risk of HIV exposure to reduce their likelihood of infection. 1. Term, 67. Select the individual below who is at most risk for contracting HIV. A 30-year-old male who has unprotected sex with multiple partners. B. A 22-year-old female who uses pre-exposure prophylaxis, PrEP, and has a monogamous relationship. C. A 45-year-old male who occasionally shares razors with a roommate. D. A 35-year-old female who receives regular blood transfusions for a medical condition in a country with strict screening protocols for blood products. Correct answer. A 30-year-old male who has unprotected sex with multiple partners. Rationale: engaging in unprotected sex with multiple partners significantly increases the risk of contracting HIV due to the high probability of exposure to the virus without any protective barrier. The use of PrEP in option B greatly reduces the risk of HIV infection, making it a less likely option. Sharing razors, as mentioned in option C, poses a theoretical risk but is much less likely to result in HIV transmission compared to direct sexual contact. Option D involves a controlled medical procedure where blood products are screened for HIV, significantly reducing the risk of transmission through transfusions. Therefore, the behavior described in option A presents the highest risk for contracting HIV. A patient with HIV presents with oral white patches that are painful. The nurse recognizes these symptoms as indicative of which opportunistic infection? A. Kaposi sarcoma. B. Tuberculosis. C. Candidiasis. D. Pneumocystis pneumonia, PCP. Correct answer, C. Candidiasis. Rationale: painful white patches in the mouth of an HIV-positive patient are indicative of oral candidiasis, commonly known as thrush. This opportunistic fungal infection is common in immunocompromised individuals, such as those with HIV, and its presence can signify immune system suppression. Treatment involves antifungal medications, and consistent ART can help prevent its recurrence. Which laboratory value is crucial for monitoring the effectiveness of antiretroviral therapy in a patient with HIV? A. White blood cell count. B. Hemoglobin level. C. Viral load. D. Platelet count. Correct answer, C. Viral load. Rationale: the viral load test is a key indicator of the effectiveness of antiretroviral therapy, ART, in patients with HIV. It measures the amount of HIV RNA in the blood. A decreasing viral load suggests that ART is working to suppress the virus, while an increasing viral load could indicate a lack of response or resistance to therapy. Regular monitoring is essential to assess treatment efficacy and guide any necessary adjustments. Which strategies are most effective for preventing sexual transmission of HIV? A. Regular use of condoms during intercourse. B. Taking antiretroviral therapy as prescribed. C. Avoiding sharing personal items like toothbrushes. D. Both A and B are correct. Correct answer, D. Both A and B are correct. Rationale: combining consistent use of condoms and adherence to antiretroviral therapy forms the cornerstone of strategies to prevent the sexual transmission of HIV. Condoms provide a barrier to the virus, while effective ART reduces the viral load to undetectable levels, thereby greatly diminishing the risk of transmission. What type of infection prophylaxis is most important to initiate for a patient with HIV and a CD4+ count of 250 cells/μl? A. Influenza vaccine. B. Pneumocystis pneumonia, PCP, prophylaxis. C. Hepatitis B vaccine. D. Tuberculosis prophylaxis. Correct answer, B. Pneumocystis pneumonia, PCP, prophylaxis. Rationale: prophylaxis for pneumocystis pneumonia, PCP, is critical for patients with HIV who have a CD4+ count of less than 200 cells/μl due to their increased risk for this opportunistic infection. However, starting PCP prophylaxis for a patient with a CD4+ count close to this threshold, like 250 cells/μl, may be considered depending on individual risk factors and clinical judgment. Which of the following routes should the nurse emphasize as not a means of spreading HIV? A. Through breast milk. B. By sharing eating utensils. C. Through unprotected sexual contact. D. By blood transfusion with infected blood. Correct answer, B. By sharing eating utensils. Rationale: HIV is not transmitted through casual contact, including the sharing of eating utensils. It's important for patients to understand the actual transmission routes of HIV, such as through blood, unprotected sex, breast milk, and infected blood products, to mitigate fears and misconceptions about casual contact. The nurse should explain that the primary purpose of viral load testing in a patient with HIV is to A. Confirm the diagnosis of HIV. B. Determine the patient's CD4+ T-cell count. C. Monitor the effectiveness of antiretroviral therapy. D. Identify the presence of opportunistic infections. Correct answer, C. Monitor the effectiveness of antiretroviral therapy. Rationale: viral load testing is used to monitor how well antiretroviral therapy is controlling the HIV infection. By measuring the amount of virus in the blood, healthcare providers can determine if the treatment is effective or if adjustments are needed to better manage the patient's HIV infection. A patient with HIV asks about ways to prevent the transmission of the virus to others. What should the nurse include in the teaching? A. Only use antibiotics prescribed by a healthcare provider. B. It's safe to share personal grooming items like razors. C. Practice safe sex and consider the use of pre-exposure prophylaxis, PrEP, for partners. D. HIV is not contagious, so no special precautions are needed. Correct answer. C. Practice safe sex and consider the use of pre-exposure prophylaxis, PrEP, for partners. Rationale. To prevent the transmission of HIV, practicing safe sex, including the correct and consistent use of condoms, is essential. Pre-exposure prophylaxis, PrEP, is also recommended for partners who are at high risk of contracting HIV, as it significantly reduces the risk of transmission. Pre-exposure prophylaxis, PrEP, is a preventive strategy that involves regular intake of antiretroviral medications such as Truvada, Descovy, or Apretude by individuals at high risk of HIV exposure to reduce their likelihood of infection. What is the main pathological mechanism in multiple sclerosis, MS? A. Loss of myelin in the central nervous system. B. Increased activity of nerves outside the brain and spinal cord. C. Obstruction of neurotransmitter release. D. Excessive formation of myelin around nerves. Correct answer. A. Loss of myelin in the central nervous system. Rationale. Multiple sclerosis, MS, is characterized by the loss of myelin, which is the protective covering of nerve fibers. This loss leads to disruption in the normal communication between the brain and the body, resulting in the neurological symptoms of MS. In the initial stages of multiple sclerosis, MS, patients often report various symptoms as the immune system begins to attack the myelin sheath of nerve fibers, impairing the communication between the brain and the body. Which of the following symptoms are commonly reported in the early phase of MS? Select all that apply. A. Involuntary shaking movements. B. Heightened reflex actions. C. Persistent tiredness or fatigue. D. Increase in muscle mass. E. Problems with vision. F. Numbness or weakness in one or more limbs. G. Sensations of tingling. Correct answers. C. Persistent tiredness or fatigue. E. Problems with vision. F. Numbness or weakness in one or more limbs. G. Sensations of tingling. Rationale. In the early stages of multiple sclerosis, MS, common symptoms include persistent tiredness or fatigue, problems with vision such as blurred or double vision, numbness or weakness typically on one side of the body or in parts of the body, and tingling sensations. These symptoms reflect the initial effects of the immune system's attack on the myelin sheath surrounding nerve fibers in the central nervous system, disrupting nerve signal transmission. In contrast, involuntary shaking movements and heightened reflex actions are less commonly initial symptoms, and an increase in muscle mass is not associated with MS, where muscle weakness and loss of muscle mass may occur as the disease progresses. What is the most prevalent type of MS? A. Progressive relapsing MS. B. Primary progressive MS. C. Relapsing remitting MS. D. Secondary progressive MS. Correct answer. C. Relapsing remitting MS. Rationale. Relapsing remitting MS is the most common form of the disease, characterized by clear episodes of neurological symptoms, relapses, followed by periods of partial or complete remission. In managing an exacerbation of MS symptoms, which group of medications is primarily utilized to reduce inflammation? A. Corticosteroids. B. Anticholinergics. C. Cholinergics. Milliliters per minute. D. Beta blockers. Correct answer. A. Corticosteroids. Rationale. Corticosteroids are often the first line of treatment during an MS exacerbation. They help to reduce the immune system's inflammatory response, thereby lessening the severity and duration of flare-ups. What are the standard diagnostic methods for multiple sclerosis, MS? A. Based entirely on physical symptoms. B. Blood analysis for specific MS markers. C. Magnetic resonance imaging, MRI, and potentially a spinal tap. D. Electroencephalogram, EEG, showing abnormalities in brain activity. Correct answer. C. Magnetic resonance imaging, MRI, and potentially a spinal tap. Rationale. Diagnosis of MS typically involves MRI scans to identify areas of demyelination in the central nervous system and may include a lumbar puncture, spinal tap, to analyze cerebrospinal fluid for inflammatory markers of MS. What is the primary cause of damage in systemic lupus erythematosus, SLE? A. Regeneration of neurons in the CNS. B. Hyperactivity of the immune system leading to inflammation. C. Improved apoptosis processes in cell structures. D. Underproduction of anti-nuclear antibodies. Correct answer. B. Hyperactivity of the immune system leading to inflammation. Rationale. SLE is an autoimmune disease where the immune system is hyperactive and causes inflammation that can damage various tissues and organs throughout the body. What characterizes the course of lupus, SLE? A. Continuous and constant symptoms without remission. B. Flare-ups interspersed with periods of remission. C. Immediate resolution of symptoms with treatment. D. Gradual improvement without treatment. Correct answer. B. Flare-ups interspersed with periods of remission. Rationale. Lupus is known for its unpredictable course, often characterized by flare-ups of symptoms followed by periods of remission. Which demographic is most commonly affected by systemic lupus erythematosus, SLE? A. Men in their late adulthood. B. Women in their childbearing years. C. Children under the age of 10. D. Elderly men and women equally. Correct answer. B. Women in their childbearing years. Rationale. SLE most commonly affects women, particularly those in their childbearing years, and is more prevalent among women of color. In the management of an SLE flare-up, which laboratory test is crucial for diagnosis and monitoring of the disease? A. Complete blood count, CBC. B. Anti-nuclear antibody, ANA, test. C. Blood urea nitrogen, BUN. D. Electrolyte panel. Correct answer. B. Anti-nuclear antibody, ANA, test. Rationale. The ANA test is crucial in diagnosing lupus because it detects autoantibodies that are commonly present in the condition. What is a key factor in the pathophysiology of lupus related to cell death? A. Effective apoptosis leading to decreased cell debris. B. Ineffective phagocytosis resulting in buildup of apoptotic bodies. C. Hyperactive macrophages consuming healthy cells. D. Decreased production of nuclear antigens. Correct answer. B. Ineffective phagocytosis resulting in buildup of apoptotic bodies. Rationale. Lupus involves a problem with how the body gets rid of dead cells. Usually, the body eats up these dead cells using phagocytosis. In lupus, this cleaning process doesn't work well, causing dead cells to pile up. This pileup can kickstart the immune system to act wrongly, leading to inflammation and the creation of harmful antibodies that attack the body itself. These wrong attacks are a big reason for the inflammation and organ damage seen in lupus, showing why getting rid of dead cells properly is crucial in stopping such immune system mistakes. A nurse is counseling a patient with systemic lupus erythematosus, SLE, about managing sun exposure. Which recommendation is most appropriate? A. Sun exposure has no effect on SLE symptoms. B. Sunscreen is only necessary on sunny days. C. Apply a broad-spectrum sunscreen with an SPF of at least 30. D. Tanning beds are a safe alternative to natural sunlight. Correct answer. C. Apply a broad-spectrum sunscreen with an SPF of at least 30. Rationale. Patients with SLE are often photosensitive, meaning UV light can trigger skin rashes and potentially cause a flare-up of the disease. Using broad-spectrum sunscreen with an SPF of at least 30 can help protect the skin from UV rays. Sunscreens should be applied liberally and regularly, even on cloudy days, as UV light can penetrate clouds. During an assessment, a nurse notes that a patient with systemic lupus erythematosus, SLE, has developed a malar rash. This type of rash is characterized by A. A butterfly-shaped rash covering the cheeks and bridge of the nose. B. A rash that appears only on sun-exposed areas of the arms and legs. C. Hyperpigmentation on the dorsal side of the hands. D. Small, round lesions that are spread widely across the torso. Correct answer. A. A butterfly-shaped rash covering the cheeks and bridge of the nose. Rationale. A malar rash, also known as a butterfly rash, is one of the classic manifestations of SLE. It appears over the cheeks and the bridge of the nose and is often worsened by sun exposure. Its recognition is important as it is one of the diagnostic criteria for SLE. Which statement by a patient with systemic lupus erythematosus, SLE, indicates a need for further teaching about the condition? A. I should notify my doctor if I develop a fever or persistent fatigue. B. I can reduce flare-ups by managing stress and getting enough rest. C. As long as I feel good, I don't need to follow up with my rheumatologist. D. I understand that quitting smoking is important to manage my SLE. Correct answer. C. As long as I feel good, I don't need to follow up with my rheumatologist. Rationale. Regular follow-up with a rheumatologist is crucial for monitoring disease activity and medication effectiveness in SLE, even when the patient feels well. This is because SLE can cause internal organ complications that may not immediately produce symptoms. The patient should understand the importance of regular medical appointments as part of their long-term disease management. A nurse is caring for a patient diagnosed with systemic lupus erythematosus, SLE. The healthcare provider prescribes hydroxychloroquine for the patient's treatment plan. What is the primary reason for administering hydroxychloroquine to this patient? A. To manage acute lupus flare-ups. B. To reduce the risk of lupus nephritis. C. To decrease inflammation and suppress the immune response. D. To treat skin lesions and rash associated with SLE. Correct answer. C. To decrease inflammation and suppress the immune response. Rationales. C. Hydroxychloroquine is an antimalarial drug that has immunomodulatory effects, which are beneficial in the treatment of autoimmune diseases like SLE. It helps decrease inflammation and suppress the immune response, which are central to the pathophysiology of SLE. This reduction in immune system hyperactivity helps in controlling the progression of the disease and mitigating systemic symptoms, making it the primary reason for its use in SLE patients. Select all that apply. A 65-year-old male patient has experienced full-thickness electrical burns on the legs and arms. Which complications are associated with this type of injury? A. Acute kidney injury. B. Dysrhythmia. C. Iceberg effect. D. Hypernatremia. E. Bone fractures. F. Fluid volume overload. Correct answer. A. Acute kidney injury. B. Dysrhythmia. C. Iceberg effect. E. Bone fractures. Rationale. Full-thickness electrical burns can cause internal damage, often more extensive than what is visible on the skin. Iceberg effect. The heat generated by the electrical current can cause muscle damage, releasing myoglobin that can lead to acute kidney injury. The electrical current can also affect the heart, potentially causing dysrhythmias. Additionally, it can cause bone fractures due to violent muscle contractions during the electrocution or thermal injury to the bone itself. True or false? A patient who experiences an alkali chemical burn is easier to treat because the skin will neutralize the chemical rather than with an acidic chemical burn. Correct answer. False. Rationale. Alkali burns are more dangerous and difficult to treat because alkalis penetrate deeper into the tissues than acids. The saponification process caused by alkalis results in a liquefaction necrosis, allowing the alkali to continue to penetrate and cause damage over time. As the nurse providing care to a patient who experienced a full-thickness electrical burn, what should you monitor in the patient's urine? A. Hemoglobin and myoglobin. B. Free iron and white blood cells. C. Protein and red blood cells. D. Potassium and urea. Correct answer. A. Hemoglobin and myoglobin. Rationale. Monitoring for hemoglobin and myoglobin in the urine is essential following an electrical burn due to the risk of muscle damage, rhabdomyolysis, which can lead to renal injury. Myoglobin is released from damaged muscles and can cause kidney injury when excreted in the urine. Select the patient below who is at most risk for complications following a burn. A 42-year-old male with partial thickness burns on the front of the right and left arms and legs. B. A 25-year-old female with partial thickness burns on the front of the head and neck and front and back of the torso. C. A 36-year-old male with full thickness burns on the front of the left arm. D. A 10-year-old with superficial burns on the right leg. Correct answer. B. A 25-year-old female with partial thickness burns on the front of the head and neck and front and back of the torso. Rationale. The 25-year-old female is at the most risk for complications due to the extent and location of the burns. Burns to the head and neck can compromise airways, and burns to the torso can affect breathing and mobility. Additionally, partial thickness burns over a large surface area increase the risk of infection and fluid loss. The underscore layer of the skin helps regulate our body temperature. A. Epidermis. B. Dermis. C. Hypodermis, subcutaneous layer. D. Fascia. Correct answer. C. Hypodermis. Rationale. The hypodermis, also known as the subcutaneous layer, is the deepest layer of the skin. It contains fat and connective tissue that insulates the body, helping to regulate body temperature. Which of the following is a priority nursing intervention during the resuscitative phase for a patient with severe burns? A. Monitoring hourly urine output. B. Providing oral care every 2 hours. C. Applying silver sulfadiazine cream to burns. D. Encouraging high-calorie meals. Correct answer. A. Monitoring hourly urine output. Rationale. During the resuscitative phase of burn care, monitoring hourly urine output is critical for assessing fluid status and kidney function. It is a key indicator of the effectiveness of fluid resuscitation and helps prevent acute kidney injury, a common complication associated with severe burns. A patient with burns is receiving escharotomy treatment. The nurse understands that this procedure is necessary to A. Prevent infection of the burn wound. B. Remove dead tissue to promote healing. C. Relieve pressure and restore circulation. D. Assess the depth and severity of the burn. Correct answer. C. Relieve pressure and restore circulation. Rationale. Escharotomy is a surgical procedure performed to relieve pressure and restore circulation. In severe burns, the eschar, dead tissue resulting from a burn, can form a tight, inelastic crust over the wound, which can compromise circulation to the area and create a tourniquet-like effect. In the case of a chemical burn, what is the first action the nurse should take? A. Neutralize the chemical with an antidote. B. Begin immediate intravenous fluid resuscitation. C. Remove contaminated clothing and irrigate the skin. D. Apply sterile dressings to the affected area. Correct answer. C. Remove contaminated clothing and irrigate the skin. Rationale. Immediate removal of contaminated clothing and irrigation of the skin are the first steps in the treatment of a chemical burn. This helps to stop the burning process by removing the chemical substance from the skin. Term 68. Which of the following best describes the appropriate sequence of stages in the care of a burn patient from initial injury to rehabilitation? A. Initial resuscitation, wound closure, rehabilitation, acute care. B. Acute care, initial resuscitation, wound closure, rehabilitation. C. Initial resuscitation, acute care, wound closure, rehabilitation. D. Wound closure, initial resuscitation, acute care, rehabilitation. Correct answer. C. Initial resuscitation, acute care, wound closure, rehabilitation. Rationale. The care of a burn patient progresses through specific stages. Initially, resuscitation within the first 24 to 48 hours focuses on stabilizing vital signs and managing fluids. Acute care follows, emphasizing infection control and pain management. Wound closure then seeks to heal and repair skin damage. Lastly, rehabilitation involves physical, cosmetic, and psychological therapies to restore function and appearance and address mental health, marking a continuous journey towards recovery. This sequence ensures comprehensive, holistic care for burn survivors. A patient with second-degree burns, over 25% of their body is at risk for which complication during the acute phase? A. Hypothermia. B. Hypernatremia. C. Curling ulcer. D. Myocardial infarction. Correct answer: C. Curling ulcer. Rationale: patients with significant burns are at risk for Curling ulcer, which is a stress-related gastric ulcer that can occur during the acute phase following severe burns. It results from the physiological stress of the injury and the resultant hypersecretion of gastric acids. Match the correct type of burn to its description. A. First-degree burn. B. Second-degree burn. C. Third-degree burn. D. Fourth-degree burn. 1. Affects the outer layer of skin called the epidermis and is usually red without blisters. 2. Extends to the subcutaneous layer of tissue and appears as dry, waxy, white, leathery, or charred black in color. 3. Affects the first layer of skin and extends to the dermis, usually red, shiny, with fluid-filled blisters and extremely painful. 4. Extends into muscle and bone, usually has no pain since nerve receptors are destroyed, may appear white or black and charred, and may have eschar formation. Correct answer: 1. A. First-degree burn. 2. C. Third-degree burn. 3. B. Second-degree burn. 4. D. Fourth-degree burn. Rationale: first-degree burns involve only the epidermis, presenting with redness but no blisters. Second-degree burns extend through the epidermis to the dermis, characterized by redness, shine, and painful blisters. Third-degree burns reach the subcutaneous tissue, showing a dry and leathery appearance, potentially in white, waxy, or charred black colors. Fourth-degree burns penetrate deeper into muscle and bone, often resulting in a loss of pain sensation due to nerve destruction, and may be accompanied by white or black charred skin with eschar formation. The nurse is educating a patient on home safety to prevent burns. Which of the following is an important point to include? A. Set water heater temperatures below 120 degrees Fahrenheit, 48.9 degrees Celsius. B. Keep flammable materials near the stove for convenience. C. Use 3-prong plugs and 2-prong outlets for older appliances. D. Store gasoline in the basement for easy access. Correct answer: A. Set water heater temperatures below 120 degrees Fahrenheit, 48.9 degrees Celsius. Rationale: to prevent burns at home, especially scalding from hot water, it is important to set water heater temperatures to below 120 degrees Fahrenheit. This temperature is hot enough for household use while being below the threshold that typically causes scalding burns. A patient arrives with a burn that is red, dry, and painful, but without blisters or edema. The skin peels away to reveal new epidermis. Which degree of burn does this describe? A. Superficial partial thickness, first degree. B. Superficial second degree, superficial partial thickness. C. Deep second degree, deep partial thickness. D. Third degree, full thickness. Answer: A. Superficial partial thickness, first degree. Rationale: superficial partial thickness burns involve only the epidermal layer, resulting in pain and redness without blistering or edema. This level of burn is consistent with the symptoms described. A nurse is assessing a patient with red, blistered skin that blanches with pressure and mild to moderate edema. What is the most appropriate classification for this burn? A. Superficial partial thickness, first degree. B. Superficial second degree, superficial partial thickness. C. Deep second degree, deep partial thickness. D. Third degree, full thickness. Answer: B. Superficial second degree, superficial partial thickness. Rationale: superficial second-degree burns extend into the dermis, appear moist and red with blistering, blanch with pressure, and can be associated with mild to moderate edema. A patient with a burn is exhibiting less moist skin with less blanching, moderate edema, and rare blistering. The patient reports some pain. What type of burn should the nurse suspect? A. Superficial partial thickness, first degree. B. Superficial second degree, superficial partial thickness. C. Deep second degree, deep partial thickness. D. Third degree, full thickness. Answer: C. Deep second degree, deep partial thickness. Rationale: deep second-degree burns extend deeper into the dermis, are less moist, have less blanching, and cause moderate edema with some pain, which may correspond with the presence of soft/dry eschar. A burn patient presents with blackened skin, severe edema, and hard inelastic tissue, but reports no pain. Which classification should be documented? A. Second degree, superficial or deep partial thickness. B. Third degree, full thickness. C. Fourth degree. D. Superficial partial thickness, first degree. Answer: B. Third degree, full thickness. Rationale: third degree burns destroy the entire thickness of the skin and can extend into the fat layer. They may appear in various colors including black, and the damage often results in no pain due to nerve destruction. A patient has been admitted with a burn that has a black appearance and has caused damage to underlying muscle, tendon, and bone. Despite the severity of the injury, the patient reports no pain. What is the classification of this burn, and why might grafting not be a viable option? A. Second degree, superficial or deep partial thickness. B. Third degree, full thickness. C. Fourth degree. D. Superficial partial thickness, first degree. Answer: C. Fourth degree. Rationale: fourth degree burns are the most severe, extending through the skin and into muscle, tendon, and bone, often appearing black. They are characterized by severe edema and the presence of eschar without pain due to extensive nerve damage. Grafting may not be effective due to the depth and extent of tissue damage, which complicates regeneration and may involve structures that do not readily regenerate. Healing is prolonged, often requiring weeks to months, and specialized care is crucial for recovery.